Income is perhaps, the most important social determinant that we know of. Again, it's certainly not necessarily directly causal, but certainly related. Well, the conditions in which people live and work, to include things like access to health care, education system, environmental conditions, safety, the neighborhoods, availability of food, those kind of things, are all important and linked to a lot of the disease conditions that we see today, such as obesity, heart disease, diabetes, mental health, those kind of things. I tend to think, though, that one of the most important things would really be to focus on the culture and education around physical fitness. Every generation since 1920 has been less fit than the generation before. That providing a universal access to health care is certainly a positive, but it's really not sufficient, as I just mentioned, to optimize the health of populations. And so there are lots of efforts. The WHO, World Health Organization, has focused efforts and has for over a decade now, looking at ways to incentivize countries to reduce those health inequities and also reduce costs of healthcare, improve access, those kind of things. There's quite a bit of evidence that links wealth and disparity of income specifically with health. The interesting thing that I don't know that we've established is whether that's directly causative or whether that's merely correlated in some way. And really related to other factors, but certainly that growing body of evidence suggests that that's the case, and particularly as we compare the wealth gap in certain countries and their health outcomes to our own. There are several screening instruments to help assess patient social needs and to explore some of their other social determinants of health. One of my favorites is the American Academy of Family Physicians has a screening tool, and there are a couple of others out there. And although they're relatively short, 10 to 15 questions in length, they do require quite a bit of time, and they're also questions that you don't necessarily always see as part of a normal visit interaction. And so there are some challenges with incorporating that into your standard office visit.